Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. Today we're talking about abuse and neglect and conversations to support your evaluación del abuso y negligencia. So of course this is for children. There's a lot of info here, a lot of great sort of questions to initiate conversation with your patients, both with parents and with children. And so if you don't have the notes yet, make sure you're on the blog post and you download the lesson notes so that you can follow along and make sure you're picking up all this vocabulary and everything. So some of the algunas de las conversaciones that you may find yourself having with parents are possibly about la situación de la familia, right? Things like el trabajo, work, los niveles de estrés, so stress levels, el sistema de apoyo en momentos difíciles, apoyo, support, so support system in difficult times. ¿Quién cuida a los niños? So who's taking care of, who's involved with the children on a day-to-day basis? And then otros temas para los padres would be el uso de alcohol y drogas, so alcohol and drug use. Cómo asegurar la casa, so how to sort of baby-proof or make the house safe for children. Las frustraciones con los niños, frustrations with children. Y algunos consejos de prevención. So those are some things that we'll be working on together with padres, and then a few of the sort of general topics of conversaciones con los niños are las heridas y las lesiones, so learning how to talk about, you know, how'd you get that injury or broken bone or cut or burn or whatever it might be. Las partes íntimas, so talking about private parts, and los secretos, discussing secrets with children. So that's what we've got coming up para los niños. Now, as you well know, some signos y síntomas de alerta that there might be some neglect or abuse happening would be things like heridas no congruentes con la edad del niño, so injuries that aren't really congruent with or don't match the child's age. Huesos fracturados, always, so broken bones. Moretes or moretones, two different words for bruises. Before we move on, moretes, moretones, of course, the more clinical word would be contusiones or hematomas, so contusions or hematomas, right? Marcas de una mano o dedos en la piel, so hand or finger marks on the skin. Múltiples lesiones en varias etapas de sanarse, so various injuries in different stages, etapas de sanarse, different stages of healing. Quemaduras, burns. El niño se porta de una manera sexual que no corresponde a su edad. So, se porta, el niño se porta, so the child behaves. Portarse is our verb to behave. So the child behaves de una manera sexual, in a sexual way, that doesn't match their age. Okay. Hey, these videos, hopefully you're learning something already. We're about to dive into all the content, but these videos are only possible because of the fact that they're being seen by people around the country. And so you really help us spread our Spanish training and help others improve their Spanish when you like and subscribe to our channel. And so please take a moment to like the video, subscribe to our channel on YouTube, and be sure to share videos that you think are particularly helpful for folks working on medical Spanish. Okay, let's take a look at factores de riesgo de abuso, some risk factors of abuse. So primero sería una historia de abuso en la familia, so history of abuse in a family. Trastornos mentales, so trastornos is the way that we say disorders. Trastornos mentales like depresión, estrés postraumático, etc. Estrés financiero like desempleo, so financial stress, desempleo, unemployment. Aislamiento de apoyo social y familiar, so aislamiento, isolation. Isolation de apoyo, remember apoyo? We saw it earlier, support. Social support and familial support. Falta de conocimiento. Falta de is lack of anything. Conocimiento, knowledge, sobre el desarrollo y el parentesco. So lack of knowledge around development child development and parenting skills. Un niño en la familia con discapacidades. And so a child in the family, whether it is the child who's your patient or not, but a child with disabilities, adding stress and burden on the whole family environment. Okay, muy bien. So, temas de conversación con los padres. Let's take a look at some of the questions you might want to be asking and ways to sort of begin some conversations with parents. ¿Quién tiene acceso a los niños? Now we're going to talk, this first set of questions is all about who's got access to the children. ¿Quién vive o duerme en la casa con usted or ustedes? So who lives or sleeps in the home with you? ¿Quién le ayuda con los niños? Who helps you with the kids? ¿Quién los cuida? Who takes care of them? ¿Quién los cuida cuando tiene que salir? When you have to go out. Okay, so that's who's got access to the kids. El estrés financiero. ¿Cómo va el trabajo? How's work going? Open-ended question, right? ¿Cuál es su horario de trabajo? What's your work schedule? Horario, schedule. ¿Quiénes en la casa trabajan para ayudar con las necesidades? So who in the home is working to help with necessities? ¿Se preocupa? Do you worry about? ¿Se preocupa por tener lo suficiente para comprar de comer y pagar los servicios públicos? So do you worry about having enough para comprar in order to purchase food and pay your services? Utilities, essentially. Okay, continuing. Temas con los padres. La frustración. A few questions to talk about frustrations. ¿Su bebé llora mucho o está contento? Does your baby cry a lot or are they happy? ¿Su bebé es tranquilo o resiste mucho? Is your baby tranquilo is peaceful or in a lot of ways just like low-key, chill, o resiste mucho, or does it resist a lot? El uso de sustancias, so substance use. ¿Con qué frecuencia toman cervezas, licores u otras bebidas alcohólicas en la casa? So how often do y'all drink beer, spirits, or other alcoholic beverages en la casa, at the home? Tragos and copas are two easy ways to talk about, not easy, but frequent ways people describe drinks. So a trago would be any sort of hard liquor drink, tequila, whiskey, lo que sea, ron. Copas, typically for wine, okay? So a glass of wine, copa. All right? ¿Qué tipo de drogas hay en la casa? What kind of drugs are there in the home? Okay, let's switch topics now to preguntas sobre heridas y lesiones. We're still talking to parents, but questions now about some injuries or wounds that the child has. ¿Qué le pasó al niño? What happened to the child? ¿Dónde estaba el niño? Where was the child? ¿Dónde estaba usted? Where were you? ¿Cómo ocurrió? How did it happen? ¿Cuándo ocurrió? When did it happen? ¿Qué hacía cuando ocurrió? What were you doing, or what was he or she doing when it happened? So this ¿qué hacía could be directed toward usted as parent, or él or ella about the child. ¿Qué hacía él? ¿Qué hacía ella? ¿Qué hacía usted? ¿Cuándo ocurrió? When it happened. ¿Con quién estaba? Who was he or she with? ¿Por qué esperó para llevar a su hijo a la clínica? Why did you wait to take your child to the clinic? Or you swap that out with el hospital, el departamento de emergencias, etc. Okay, vamos a continuar. So now talking with kids about injuries. Okay, what are some ways that we could initiate conversation with them about some wounds or injuries that they have? ¿Qué te pasó? ¿Cómo ocurrió esta lesión? What happened to you? How did you get this injury? ¿Cómo te quemaste? How did you burn yourself? ¿Cómo te cortaste? How did you cut yourself? ¿Qué hacías para magullarte así? What were you doing to bruise yourself like that? ¿Cómo se fracturó el brazo o la pierna? Fill in the body part there. How did you fracture your arm or leg, or again, fill in the blank. ¿Y esta lesión? Cuéntame la historia de esta. And this injury here, tell me the story about that one. You're probably noticing that between these questions here and the previous slide, a ton of focus on past tenses. And so if you're not familiar with past tenses, we'll be sure to link up down below in the blog post about to some other lessons where you can begin working on past tenses if that's unfamiliar. Okay? All right, for now, let's continue to some mensajes and preguntas sobre el abuso sexual. So some messages, and think of it as education and questions about sexual abuse. Okay, algunos mensajes. Obviously not an exhaustive list, but a few things you might communicate frequently. No es normal, it's not normal que otras personas te toquen, that other people would touch you or miren tus partes íntimas, or that they would be looking at your intimate parts, private parts. No es normal que te pidan mirar o tocar sus partes íntimas. It's also not normal that they would ask you to touch or look at their private parts. Es importante que le digas a alguien de confianza. It's important that you tell someone who's trusted si alguien te ha tocado, if anyone has touched you, o pedido que le toques or asked you to touch them de una manera inapropiada, in an inappropriate way. So some questions. ¿Alguna vez alguien te ha tocado en tus partes íntimas? So alguna vez is how we ask ever. So has anyone ever touched you in your private parts? ¿Alguna vez te ha enseñado tus partes íntimas? Has anyone ever shown you your private parts? ¿Alguna vez alguien ha pedido que le tocara en sus partes íntimas? So has anyone ever asked you to touch their private parts? Sexual abuse, continuing, okay? Los secretos. ¿Alguien te ha amenazado o ha amenazado a alguien en su familia por hablar sobre secretos? Has anyone threatened you? Amenazar is the verb to threaten. So, ¿alguien te ha amenazado? Has anyone threatened you? O amenazado a alguien en su familia? Or threatened someone in your family por hablar sobre secretos for talking about secrets? ¿Alguien te ha pedido guardar un secreto para siempre de tus padres? Has anyone ever asked you to keep a secret forever from your parents? Okay, let's move on to vocabulario de anatomía y abuso. So, anatomía, we've got la boca, mouth, los brazos, arms, el cachete o la mejilla, cheek, las caderas, hips, la cara, face, la espalda, back, los muslos, thighs, los pechos, breasts, el pene, penis, las piernas, legs, la pompis, bottom, la vagina, vagina, and some verbos, some acciones. Agarrar would be to like grab someone. Amenazar, to threaten. Dar cachetazos, to give a slap on the cheek. Dar nalgadas, to like spank on the bottom. Gritar, to yell or scream. Pegar, to hit. Tener miedo de, to be afraid of maybe an action or a person or a situation, whatever it might be. Tener miedo de is to be afraid of. Okay, hey, one more time, help us reach more people by liking and sharing this video, and comment on it, particularly if you're learning something new. Okay, algunos consejos para los padres y para la casa. So, para hacer la casa a prueba de niños, so child-proof, es buena idea, it's a good idea to acostar al bebé en la cuna, of course, boca arriba, mouth up, right, on their back, en vez de la cama. So put your child to bed in the crib, not in a bed, okay? Usar rejas de seguridad en las escaleras. So use the stairway blockers on stairs, right? So the kids can't fall down the stairs or go up and then fall down. Usar protectores en los tomacorrientes. So use those plugs for the outlets, right? Use the outlet covers. No dejar los electrodomésticos enchufados. Don't leave the appliances plugged in. Typically things like on the countertop and stuff like that. No dejar que jueguen en la cocina. Don't allow the kids to play in the kitchen. Guardar y asegurar bien los productos de limpieza. So store and keep safe cleaning products. Guardar los medicamentos. So store your medications safely. And asegurar las armas en una caja fuerte. Be sure that you lock up any weapons or firearms in a safe. Consejos. Consejos para prevención de la negligencia. So, suggestions to prevent negligence. Es importante que usted le mantenga una mano en su bebé cuando está en la sobremesa u otro lugar alto. You keep a hand on your baby when they're on the countertop or in any other place that is high. Esté presente vigilando a su bebé mientras se baña. That you're present watching your baby as they bathe. Sepa que la cocina es un lugar peligroso. That you know that the kitchen is a dangerous place. No permita que abra la puerta. That you don't allow your baby to open the door. Continuamos con prevención de negligencia. Es importante que usted, it's important that you guarde las llaves, la bolsa y pulverizadores de pimienta fuera del alcance de los niños. So that you would keep your keys, your purse, and any like pepper sprays or anything like that fuera del alcance, out of reach of babies, of kids. Baje la temperatura del calentador de agua, that you lower the temperature on your water heater. Tenga un plan para cuando el bebé no deja de llorar, that you have a plan for when the baby doesn't stop crying. Por ejemplo, ponerlo en su cuarto, for example. Put him in his room, or su cuna, or crib, y descansar un momento, and take a break. O pedirle ayuda a un familiar o un vecino, or ask help from a family member or a neighbor. ¿Con quién puede contar cuando necesita ayuda? Who can you count on when you need help? Okay, that's it for our lesson today on conversations about abuse and neglect. Of course, it's not an exhaustive list, so if you've got questions, if you've got other things you'd like to communicate, be sure to post your questions down in the comment section and we'll be sure to help them. I'm recognizing that maybe one of the frases that I didn't include in here was talking about safe people, like how do you like to communicate that only the doctor and your parent can see your private parts, kind of thing. So put some of those phrases in the comment section and give it a shot in Spanish and we'll be glad to help you with them. Okay, amigos, gracias por aprender español conmigo. Juntos mejoramos comunidades. Para más español, head over to the website, commongroundinternational.com. Y if you'd like to take a free medical Spanish terminology test, head over to Certified Spanish, create your free account, and you can take as many free terminology tests as you would like. Okay, amigos, nos vemos pronto. Ciao.